My name is Susan Walley, and I'm a pediatrician and live in Vestavia Hills. Today is March 25th, and although it's hard to believe, only 12 days ago, Governor Kay Ivey declared a state of emergency due to the global pandemic COVID-19. COVID-19 is a disease that's caused by the novel coronavirus and has infected more than 51,000 people in the United States and 238 people as of this morning in Alabama. So how can you help yourself and your family stay healthy mentally, emotionally, and physically? So the first point is that this is serious. It is a global pandemic, but we're all in this together. We do know that COVID-19 affects people who are over 65 years of age, those who have chronic medical conditions, and weaken immune systems more seriously. Here in the United States, we also have seen that people who are 20 to 44 years of age seem to be more seriously affected, which means that they're hospitalized more and in the intensive care units more than in other countries. We don't know why that is, but it just means that all of us need to be very careful. The second main point goes along with that. We want to keep ourselves healthy so we can take care of our children, our families, and the entire Vestavia Hills community. So what that means is that we need to be practicing social distancing and hand hygiene. So hand hygiene is the doctor terminology for washing your hands really, really well. At least 20 seconds with warm water and soap. 20 seconds is a long time, so it's the length of time it takes to sing happy birthday twice. Social distancing does not mean social isolation. We want to make sure that people stay connected to each other, either by calling, social media, or using things like FaceTime. But because the virus that causes COVID-19 is spread by contact and respiratory droplets, it's very important that you stay 6 feet away from people to avoid contracting the virus. And lastly, while we know that this is a very stressful time for everyone, our children in particular have a lot of anxiety and stress with this. They see their parents worried, they hear things on the news. So some tips specifically for your children are, number one, keep a routine. Although it might be really easy to think of this as vacation time, we know that children do best if you keep a routine, which means wake them up around the same time, put them to bed around the same time. If you have older children, engage them in this process in making a routine. Second is to set limits on screen time and set technology-free zones. This is a good practice all the time, but particularly right now when everybody seems to be going to social media, watching the news, checking their emails constantly. You want to be a good example as a parent. So if your kids see you on email or social media 24 hours a day, then it makes sense that they'll think that's okay for them too. The third is make sure that they're sleeping well, that they're engaging in physical activity at least 1 or 2 hours every day, and they're eating a well-balanced diet. It's important for all of us, particularly children, to stay healthy. And then lastly, if you or a loved one smoke or vape, COVID-19 is a great reason to quit. We know that smoking and vaping is not safe and it causes lung damage. And there's emerging data that people who smoke are at risk for much more severe disease from COVID-19. So again, stay well, stay healthy and happy. Thank you very much.